Hello, everybody. Thank you very much for your time and attention today. My name is Michael. I'm from Tiger Spike, and I'm here with my amazing team members that make up the Golden Team, Team Gold. We have Louisiana, Dean, Tom, Gavin, Celso, Laurie, Chris, and Deidre, who unfortunately can't be here today. So, together we are looking at disability parking permits. And I'm sure you can appreciate this already is an extremely challenging, rigid, set in stone, but above all else, sensitive topic that we're dealing with. And it really took us a long time from the onset to really understand the problem and the situation that we're trying to solve for. So what I'd like you to keep in mind throughout our presentation is the level of empathic thinking that needs to, be present throughout this process. We're going to share the presentation load. Don't talk to me, listen to me all the time throughout this presentation. However, to start with, if you cast the clock back to 10 a.m. Tuesday, only 2 days ago, this was the statement that we were presented with to start our thinking. How might we reduce community frustration around disability parking permit allocation with a process that is fair and simple? Fair and simple is pretty constant throughout our presentation here. And it's super sensitive and very important. This doesn't overcomplicate the system. It doesn't upset the balance too stringently and too drastically. It needs to be careful and very well delivered. So to start off, we're going to have Louisiana, and she's going to start walking us through why there's even a need in the first place.
Okay, so I'll start with the situation now, how things happen. We concluded that maybe things are too simplified. Why? Because there are two types of permits that people can apply for. The category 1, which allows people to park in wider spaces. Sorry, I do this. Wider spaces. And these spaces are normally close to the entrances of the establishments. And some people need more space because they need to load equipment in and out of the car, so they have to have this wider base. And the category 2 is for people who need a longer time to park. And this is because probably they have to take some breaks in the walking or the mobility process, so they need a little bit more time. And we observed during this analysis that for the first one, some people who don't need the extra space end up receiving these permits. And for the second one is that when people receive it, they're not super happy because they want it to be closer to the entrances. So our analysis also considered some numbers. Very quickly, for the overall picture, we have around 1 million people with disability in Victoria, different kinds. From these, 190,000 need some mobility equipment or some aid for moving. And we have, these numbers estimate, but we have approximately 300,000 permits for parking, disabled parking in Victoria. So what can we conclude from these quick numbers is that almost 40% of the people who have the category 1, which means the wider space, may not need this extra space for the parking. And finally, just an important fact is that mobility gets worse with age, which means that anyone as we get old, we may end up with some kind of limitation, especially mobility one. So what this can impact on our permits issue is that it might lead to more people applying for these permits because of this kind of limitation. And now I pass the microphone to Dean to talk about the success factors. Thank you very much.
Thank you. So where we started a couple of days ago was to really ask the fundamental question that I think we're all faced with any project, what does success look like? And really that has informed everything that you'll see in the coming 10 or so minutes in terms of what we've come up with. But importantly, success for us would see a reduction in the number of permits. So that's an arbitrary reduction, but it's actually an allocation of permits based on real needs and real requirements. Also, we'd see a reduction in the number of Category 1 permits. That means that the people who need those wide bay access levels and the Category 1 permits will get them. And the wide bay, the Category 1s would no longer be something that's a catch-all permit for all users or all applicants. But also success would look like a process where people are getting permits allocated based on their real needs. And we've designed a process that will address that, we believe. Also, stakeholder satisfaction is something else that we believe would be a successful outcome. So all the stakeholders, not just the applicants or their proxies, but also everyone who's involved, the GPs, the people who do the processing, and then down the track, the enforcement as well. So success for us would be wherever you live, Mallacoota, Mildura, McLeod, it's the same system. It's not dependent on the council that you live in. It's one system. And it's less paper driven. It's more digital. We'd love that. But also it's really empathetic. So if someone who has a permanent disability emerges from this new system, this new process, they feel like they've been respected and they feel like there's been empathy shown towards them. That would be success. And then finally, it's really clear. Really clear for everyone who goes into the system or participates in the system that the process is very, very clear and there's great clarity for everyone. That's what success looks like. Keep those factors in mind as we talk through our proposed solution. And I'll pass on to Tom.
Thanks, Dean. Well, we asked ourselves as a team, how did we get to this point? How have we got to the point where almost 40% of our permits, people really don't need them? And I think the conclusion we came to was all the applicants want to park close to the destination. They all want to park close to the shopping centre. They all want to park close to the hospital. So they get a paper application from the council, go to the doctor, and because the doctor knows them, he'll tick the box and say, yes, get a blue permit. Or doctor's appointments, and now some of them reduced to 11 minutes. So the doctor just ticks and flicks the form, hands it to them, and away they go. So we've got ourselves in a situation where we have an oversupply of blue permits and an undersupply of wide parking bays. So our team put their heads together over the last 2 days and come up with what we think is a solution. We suggest 3 types of permits. An accessibility permit, which is a current blue one. So the person who does require the wide parking bay, has a wheelchair, walking frame, etc., still gets access to that, but alongside that parking bay, at the entrance to the shopping centre, hospital, etc., will be a proximity bay, standard size bay, so that a permit holder who can access a normal bay can get in and out of a car safely, can get parking closer to the location they want to go to, and will still maintain the double time bays for those who can walk some distance but need some rest, so they can park and get double the time in time-limited areas. The additional benefit of a proximity bay, because it is a standard parking bay, it can be placed along parallel parking strip shopping centres at strategic points where disabled applicants need to park and go into shops, etc., ATMs and that. We also looked at, all right, this is a new system. How do we educate the community with the new system? We've been using the current 2-tiered system for decades. We decided there should be one portal that will carry all this information and some educational information for applicants That portal can be accessed via links from every council, every state government website, so that whoever is applying for the disabled permit can read information and know what the permit options are, know what the application process is, and understand and be aware of what the 3 permits are all about. So I'll now hand over to my colleague, Gavin.
Thanks, guys. So I'm actually running through the allocation workflow. Being the tech guy, I got the slide which had the going the wrong way. There we go. The process flow on it. So to try and summarise what's on the screen, because you probably can't read it, there's, as Tom just spoke to, there's 3 different permit types that we're looking to try and channel people into. And what's really important is that we make the decision to get people into those permit types a simple process and one that's less subjective. At the moment, we have a situation where a patient would walk into, or an applicant would walk into their GP, and it would be family doctor, 30 years, known you forever, don't want to lose business, so I'll just sign it off and keep you going. What we've got an opportunity for here, and we've discussed, is introducing, particularly for permit holders, so people who have an undisputable ongoing disability, that they would only come in once. So at the moment, the current regime is you need to come in every 3 to 5 years, depending on the council, to get your permit renewed. So we have some very frank conversations about the disability types that have to go through that and actually revisit this, and they do it for a number of different reasons. For a number of different cards we found out, even from travelling with taxi, companion cards, those sorts of things. So they may end up at a doctor's surgery a number of times just in the same year to address their disability. So in the instance that we have somebody who requires equipment, or they are an endanger to themselves or other people if they need attention to get out of a vehicle, they are channeled down the flow for a blue permit. So we have 2 questions that get asked through this process about whether or not they need an ongoing review. So is it a condition that will improve over time? So you may have a broken leg, and within 6 months you no longer need that permit. Then you'll go through, and a review period would be set. But equally, and again a controversial topic we discussed, was around the review of somebody's ability to drive ongoing. So at the moment, these permits are in what have we got, A and B permit type. So you're either a driver and passenger or just a passenger type. And there's an ability as part of this to actually channel drivers, particularly with degrading conditions, into a different permit type after a review period. So if you've got something like MS, you're able to drive in your first few years. We want to get you back into the doctor after a 5-year period to review your ability to drive and channel you through a medical review process. Again, that wasn't a focus of what we delved into over the last couple of days. We did put that, and excuse the pun, into the parking lot. The main focus for us was working through these permit types. So the main permit type that we're talking about as part of our use case ongoing is our proximity permit. And that's where somebody can't walk a long distance, but they need a parking space that's close to the entrance. We have, again, that set of questions: will it improve, will it degrade? Determines whether they need a review, and then if not, then they'll end up with a permanent pass for life, basically. The third type, which is our time-based condition, again, we determine, well, you'll see at the top there, if we've answered pretty much, what have we got? No, and yes to the questions, and no again, you don't actually enter into the process. So it's actually quite simple to shift people out who don't require a specialist review. But then we also have a time-based where we're trying to just channel some of those people that may just need a bit of extra time to get to their vehicle to that grey permit, and try and stop that proximity park becoming the next overloaded park that people want to get their hands on. So, yep, I'm going to bring Celso over to talk through the user flow.
That's great. Thanks, Gavin. So now that we have that perfect logic working through, it's creating an objective view of how to appropriately allocate permits. What does that look like when the applicants are actually dealing with it? And what we realize is what we need to do, and it's been a constant theme, is that it needs to be a centralized services portal, right? Because they're not only carrying those type of permits, there are other permits that would need to be issued and correctly allocated. And in this portal, they would be using this centralized service that is to be designed to be AAA compliant, because we're dealing with people with disabilities. They need to be able to all use this service. And they would use this for the application of disabled parking permits. Now, we realize that from the front-end point of view, there are three main types of users that we'd like to cover. The first is the permit applicant, obviously. And here they would be dealing with the addition of their personal details, a link into Vic Roads accounts as a potential future case, to link up their driver's license, Medicare numbers, vehicle registration. We'll see how that plays a role in that process. From the registered medical professional, they will get to view the applicant's personal details, so there's no more having to fill in all of those forms all of the time, because we're trying to move from a paper-based format into a more digital. But the value in doing that is not where it just moves the form from paper to a screen. It's where we start understanding how that works, when should things be displayed and when not. And then lastly, what we'd like to introduce is actually a second form of validation, where once the registered medical professional does the assessment and submits it, it actually then goes to an allied health professional, where they will be able to perform a more accurate mobility assessment. And that combination allows the correct type of permit to be allocated. So what does this look like if we have someone going through it? So the applicant, in this case, we have Joe Average. In this case, he's actually male, as opposed to our blue team counterpart. And it's actually his birthday today, so happy birthday, Joe. So as you can see, it's a very simple form to fill out, and he only has to do this once. And he creates the profile, and this profile, because it's centralized across the other services, he never has to enter this information again. We capture some emergency contact information. If Joe has a driver's license, which in this case he does, he may enter that in, and we can see how that plays a role later on. And he has to declare what kind of disability that he has, right? And at this point, we actually created a structured list, which helps us with the data in the future. And in this case, Joe has emphysema. A couple of optional details that we could capture, for example, is if the applicant cannot complete this form, that he might have a proxy. And in this case, Janice Average, who just happens to be Joe's wife, is going to be filling this out. And so there's a contact link there as well. Medicare number. So in case that there is an alert, possibly that when the medical professional is completing the assessment, if there's some information from the Medicare that can pop up as an alert that might help the assessment, that link might be able to provide that flag at the right time. And then also to be able to add vehicles, because we know that not all permit holders have their own vehicles. They might be using vehicles for a day, and they want to extend that permit for that vehicle, perhaps for a temporary state, or perhaps they have their vehicle and maybe someone else's that they would like to use. So these are kind of the optional details that they'd be able to complete. And then they're told about what are the next steps. So here we're starting to manage the expectation, because no longer are they having to fill this out, go into another doctor's room, then go to council and submit it. This is taking care of it for them. So now there's their reference number, the application has been successfully started, and now you need to book an appointment with your doctor. Now, when he gets to the doctor, now the medical professional also has access to this platform and can search for this application using the reference number. Now, he gets a summary of the details that Joe has completed, and he can see that the declaration by Joe is that he has emphysema. Here is where we start understanding that these the assessment is the same, and so the doctor gets to also complete his diagnosis. And if it is a match, then it will go through, and we get to update the information in that way. The next part is when the medical assessment is actually being performed. Now, obviously, we don't cater for what actually is being done as part of the assessment, but in terms of the input that the doctor has to perform, the questions go as what Gavin said in terms of that flow. Does the patient require complex mobility aid? And here we show that not always, that there's confusion sometimes about what complex mobility aid is. And so we provide the medical professional with a description that is updated all the time. So let's just say Joe does not need a complex mobility aid. He is not a danger to himself or others in a public space without assistance, and but he cannot walk a reasonable distance. And what is that reasonable distance? In this case, it's a standard of 60 meters. So what's happening now is you'll see that he is now going to be qualifying for a proximity bay because he doesn't necessarily need a wide bay. He does not require equipment. Then to the next section is the patient's mobility permanent? Disability permanent? Yes, it is. Is the patient's mobility likely to deteriorate? Yes, it is. So the recommended mobility review would be in 18 months. And because there is a review, this would only qualify for a temporary permit because Joe would need to come back. At this point, then Joe is then informed that he needs to go then to the allied health professional to be able to get the second opinion. And you'll see that in this process, once he goes to the allied health professional and they perform the assessment and everything is the same and agreed to, Joe then gets a temporary proximity permit that gets issued to him. And now this is the correct permit. He doesn't get allocated a wide space bay when he didn't really require one. The impact of this is that for the permit holders, it's a sustainable and simple way to complete this. All information is centralized, readily accessible, and only captured once. The applicants receive a higher quality of healthcare because now a allied health professional is performing a mobility assessment, which is actually a lot more relevant to the permit that they're applying for. It removes the council visits, and the permanent permits means that no reoccurring GP reviews. For the medical professionals, improved communication, so the pressure is removed from them. That is an influence from the applicants. So like what Tom was saying, I have a relationship with the GPs, please just pass me forward, I just want to go closer. And then the overall process is that we have increased quality, consistent and accurate allocation of permits, and the management of the application expectation and the education by having this on that portal. Just hand over to you.
So now I'll run through some of the challenges and constraints that we had to deal with over the last couple of days. So some of the things we had to take into consideration but didn't necessarily delve into a lot of detail. So the tension between Vic Roads and local government at the moment and who should own the process versus who should enforce it. There is currently misinterpretation across councils about how it's enforced, and it is inconsistent. So they collectively are looking for a unified approach to delivering this service. Change management, there's a large number of people currently on the current system in disparate data repositories across all of our councils. So bringing those applicants on board to the new system is a challenge that we're going to have to address. Relationship with GPs, that long-term relationship that patients might have with their GP and how that feeds into the process and potentially corrupts the process as far as the quality of the applicants that are being, the quality of the applications that are being approved, and also conflicting assessment results. So we're trying to address this, as we discussed, through having a second opinion, particularly for those permanent applications, so we can reduce the number of recurring visits, but also get quality out of the applicants that are approved. So some of the constraints, permit compliance, again, that parking lot, we parked this for the next team who talk a bit about compliance. We did do a bit of cross-pollination between the teams just to make sure there wasn't any black spots, and they should be picking up most of the compliance bit, but we did cover them off for background, and I know I learned a lot, particularly in the first half of the first day, about this process and things that I didn't even know there was a green permit out there, so I'm sure a lot of people don't. Parking bay design, again, we didn't delve into that detail. We've taken a very simplistic view of you could just paint an existing car spot green and all of a sudden that's a proximity park. But again, the mechanics of that and the detail we didn't dig into. The permit issue process, again, that's the actual physical issue of the permit. Whether or not it does go on to be a physical permit or not, again, that's something the next team was talking about in a bit more detail. And also, I spoke before about that driver's license, so your actual ability to drive, and whether or not we should be tying that into this process. Again, we parked that one. The last one, which is about the application process itself, it's more about the physical attending to those appointments. So we're not trying to stop, I guess, a physical inspection of somebody and whether or not they're capable to receive a permit. Capable. Anyway, sorry. But we did address, I guess, the corruption side of it and trying to have that second opinion. So pretty much hand over to Michael.
Just lastly, guys, you can probably appreciate you cannot just overnight switch this and see green base pop up all over the place and expect it's just going to go smoothly, right? So I'll run through it quick, but the point is, we're trying to establish a really smooth rollout procedure here, focusing on the education and awareness of these changes to the general community, but especially to those in the disabled community. So starting with announcing the intended change to parking permits is probably the key. And you can do that through the public awareness website that we mentioned and through various marketing campaigns to start introducing changes to the existing process. Once people have knowledge, you can then make a change. Introduce the new permit, introduce the new parking bays, and start seeing green bays pop up all over the place. Woohoo! But you also need to work closely then with the GPs and the allied health professionals to make sure they understand what is the purpose of these bays. So again, back to the point Celso was making, that there's not a distinction or a decision getting made about what bay they need. It's more about the actual process itself and the right need for the right person. Then we've got to tackle the beast that is all those that are already on the system with existing permits. Those who have a blue permit, who might actually be appropriate for our green proximity bay permits, they're probably going to have an issue with this. But again, through going through the education process, we can ensure that they understand the reason why we're making this change. It's not to limit them, it's not to make things worse for them, it's to give them the exact right thing that they need. We talked about the national system, repeating this process, not just in one council, not just even in Victorian councils. This should be an Australian-wide thing, and why not? It could be a global thing one day. We already see evidence of it. In Brazil, there's an elderly bay, which is next to the disabled parking bay right now. We can learn from these sort of things. And lastly, the integration points we started talking about with various government services, so that things like, which is also mentioned, people repeatedly having to reprove their disability and, reapply a label to them is overly sensitive, and we don't want them to have to go through that. If all that data is collected repeatedly, they don't need to keep doing it 1,000 times over. Thanks very much.
Well done, Gold team. Whenever I come to an event like these hacks, it always, by about the third team, I'm thinking, government is really complex, isn't it? If it makes money, that's what the private sector does. If it's multi-bottom line with multiple stakeholders, with multiple challenges, with a whole range of complexity around it, that's the business of government. But that's also why these sorts of tools of design thinking and events like MavHack are, I think, so valuable, because we can unpack some of this real complexity around what government needs to do. And Gold Team, you've certainly done that. I loved the detail around your workflow and how you were going to, and I guess at the heart of what you've achieved here is you've hit on what is becoming increasingly prevalent in our life as consumers, and that is the personalisation of services. As consumers, because of digital technology, we're becoming more accustomed to the personalisation of services, and therefore, when we see that as consumers, we start to expect that as citizens, and it's really hard in government, as you've shown, to actually do that. But you really hit on that idea that it's not one size fits all. I recently, I've got a sort of a layer I'd like to add to your idea, if I might, as you go on this roadmap. I recently subscribed to the Qantas Assure app. Now, Qantas Assure connects with my Apple Watch or my Fitbit or whatever, and every time I go for a run, or in fact every step I take, the more steps I take during the day, Qantas give me frequent flyer points. I think this is a fantastic idea. Now, despite some of you what might think that it's because Qantas would like me to lose weight and therefore lighten the plane load. Actually, they're doing it because they're collecting the data of everywhere I go. They know every city I'm in, and now they know every pub I go to, or whatever else might be the case. And I think this personalisation of services that you've hit on perhaps has a geolocation element to it. And the more we're all leaving a trail of digital breadcrumbs behind us that, frankly, the commercial world is creating wealth out of, why can't we find ways to create good public value out of it? And it strikes me that parking in disabled parking spots is a great opportunity to collect geolocated data about who's parking where and when and for how long, and making that data open, another principle that we should adhere to, frankly, in government, open and transparent. We'll see more analytics of that data and therefore, I think, better planning for disabled parking spots in the future and their usage and so on. So, and perhaps also is a way of also identifying where fraud or corruption of the system's happening along the way as well. Not that it's necessarily about compliance, it's about providing a better service. So, with those thoughts, congratulations to your Gold team and thank you for unpacking a really complex problem for us. Much appreciated.